Good afternoon. Today we're going to talk about pathology consultation services at Mayo Clinic Laboratories. My name is Joaquín García. I'm a professor of laboratory medicine and pathology. I'm the vice chair of anatomic pathology laboratories. I have no disclosures. Today's learning objectives are to introduce Mayo's pathology consultation practice, understand how Mayo Clinic Laboratories manages pathology consultation cases, provide guidance for optimizing the pathology consultation experience, and recognize the value of pathology consultations. Our consultation practice has over 100 pathologists, providing subspecialty expertise spanning from autopsy all the way to urologic pathology. Each year, we evaluate over 45,000 consultation cases that fall into these 19 subspecialties. Our over 100 pathologists are academically inclined. In fact, in 2019 alone, we published over 1,300 peer-reviewed manuscripts. Over 300 were first and last authored by our consultants. You can learn more about Mayo Clinic Laboratories at mayocliniclabs.com, such as a test catalog, our pathology and subspecialty pages. You can learn about onboarding, manual and electronic orders, as well as our breadth of ongoing technical and business support. What is a pathology consult? The pathology consultation, also known as a second opinion, is typically ordered when a client pathologist has doubts about the diagnosis, the client department has disagreement about the diagnosis, or a clinician or a patient requests a diagnosis confirmation. Pathology consultation is very different from most orderable tests. This is a complex service that may vary greatly on a case-by-case basis, and that's because it requires depth and breadth of subspecialty expertise. This schematic shows the roadmap of a case that comes in for pathology consultation. Starting at the upper left, a client can collect a specimen, prepare slides, review the case internally, and order the secondary consult. Send the case to Mayo Clinic Laboratories, where we accession, deliver the case to one of our experts who reviews the case, may or may not elect to perform ancillary testing, and ultimately sign out and report the results. Let's dig a little deeper. In accessioning, a courier delivers to Mayo Clinic Laboratories Monday through Saturday. It's here that we verify that the order is complete and consistent with the received shipment. Mayo Lab Inquiry, also known as MLI, will contact the client if there are order issues. At the level of case assignment and delivery, if a case is directed to a pathologist or a section, we naturally put the case in that pathologist's hands. If a case is not directed, we will accession the case and assign it to a subspecialist expert. At the level of case review, a pathologist and potentially a trainee, if they're on a rotation, will conduct the initial review and may elect to perform additional analysis, such as immunohistochemistry, molecular, cytogenetics, on submitted unstained slides or blocks. If genetic or cytogenetic testing is required, that material will go through tissue slide review, where we make sure that the specimen meets validation requirements for downstream testing. Lastly, we will sign out the case after reviewing the test results and creating the final pathology report, and we will return the materials to the client. As I mentioned previously, there's a wide range of case complexity in the pathology consultation practice. This range in complexity is a function of the number of specimen types that are submitted, imaging that may or not be interpreted on our end, ancillary testing that's required, such as immunohistochemistry, molecular, cytogenetics, and of course, if we have to share this with our expert colleagues as well. This leads to increasing complexity, duration, and of course, cost. It's important to optimize your experience with the pathology consultation practice at Mayo Clinic Laboratories. We require both the pathology report and Mayo Clinic Laboratories account number for our consultations. The client pathology report allows us to positively identify the patient and appropriately match the specimen with the order. The required information includes the patient, name, date of birth, the date of service, gross description, slides and block IDs, the client pathology accession number, and specific questions the client would like answered. The Mayo Clinic Laboratories account number, or MCL account number, is essential for reporting results and billing. Most of our consultation delays are caused by missing information. Please contact us if a new MCL account number is needed. Of course, select cases require radiographic imaging studies to correlate histopathologic findings, for example, in bone tumors, central nervous system tumors, and medical lung disease. Pertinent laboratory work is also valuable for evaluating medical renal and medical liver biopsies. Our practice has over 100 pathologists across our campuses with broad subspecialty expertise falling into 19 categories. Our depth of experience in esoteric testing includes over 3,000 Department of Laboratory Medicine and Pathology tests. Naturally, we are integrated with our clinical practice and consistently collaborate with subspecialty experts within our department. Our processes have extensive quality controls to drive the best of breed pathology consult service. And of course, we couple that with superior lab and administrative staff. To get started, you can contact us, or for additional information and instructions, contact a customer service representative at 800-533-1710, or you can visit our test catalog at www.mayocliniclabs.com. Thank you.